I am a good enough person to forgive you, but I'm not stupid enough to trust you again. Now, the diagnosis of the Pityriasis alba by the clinical examination examine patients for keratotic lesions, for psoriasis, and atopic dermatitis. By Wood's light over skin reveal further lesions. Wood's light examination will determine presence of the vitiligo and potassium hydroxide QH stain of a skin scraping to exclude tinea versicolor, tinea facial, or the tinea corporis, which are the fungal infection and can be seen very easily by the KOH preparation. Skin biopsy to rule out mycosis fungoides, cutaneous T-cell lymphoma, and in the diagnosis, the following features have been seen on biopsy: hyperkeratosis in 33.33%, parakeratosis 40%, acanthosis 53%, and spongiosis have been seen in 80% cases. So in diagnosis, we do have perivascular infiltrate 100%, irregular or markedly reduced pigment by melanin of the basal layer seen, no significant difference in melanocyte count between lesional and normal skin, reduced number of active melanocytes, and decreased number and size of melanosomes in the affected skin has been seen. Now, the differential diagnosis of the Pityriasis alba is Pityriasis versicolor, tinea versicolor, here fine scales with the greenish yellow fluorescence under the wood lamp seen, leprosy seen in the endemic area of white color, anesthetic macules seen, nevus depigmentosis, stable congenital off-white macules seen unilaterally. Nevus animicus does not enhance with wood lamp, does not show erythema after rubbing. Then psoriasis with scales, tinea corporis, diluinal tinea, these are the fungal infection, can be seen by the KOH preparation, and vitiligo, it has got very peculiar picture. So there one can see the tinea versicolor or Pityriasis versicolor, nevus nemicus, and here the nevus depigmentosis and diluinal tinea, tinea corporis, and vitiligo, leprosy, psoriasis on the face. So by having these features, one can differentiate the different. So the continuing the differential diagnosis: hypopigmented mycosis fungoides, cutaneous T-cell lymphoma, biopsy is necessary, nubular eczema, discoid eczema, pityriasis rosea, seborrhea, post-inflammatory hypomelanosis, leukoderma, atopic dermatitis, contact dermatitis, side effect of the certain medication such as retinoid, benzoyl peroxide, and topical steroids. Then tuberous sclerosis, stable congenital off-white macules which are called ash leaf shaped macules, and then pyebaldism, congenital white forelook on the forehead and the hairs. I have already given one lecture on this pyebaldism for detail. One can read and check that. And here mycosis fungoides, nubular eczema, discoid eczema, and pityriasis rosea, and seborrheic dermatitis, and post-inflammatory hypopigmentation, contact dermatitis that is seen on the different parts of the body, atopic dermatitis on the face, and here's the redness on the face. So one can see the different feature of the different diseases and just can differentiate Pityriasis alba from all these lesions which have got a different picture as one can see in the Pityriasis alba. Drug-induced vitiligo, and here there is pyabaldism, the white forelock, post-inflammatory hypopigmentation, and then there is tuberous sclerosis, ash leaf macule spots. And here is the role of a teacher. The teacher, just whatever he has in his brain, and that is like a candle. He is putting this candle and the wax of his brain to the students who are having this empty brain, and that is going to fill the teacher knowledge to these students. Now, coming to the treatment, there is no treatment usually. Patches in the time will settle automatically. Simple emollients, the redness, scale and itch is managed. Topical steroids, low potency class, which can be applicable on the face, are being used only. These are grade 5 and 6 like hydrocortisone 1%, daisonide 0.05% and prednicarbate, which are permissible to be used on the face. Then fluocinolone 0.01% to 0.025%, class 4, 5, 6 can be used. Potent topical steroid produce atrophy of the skin and acne from eruption. So one have to avoid all these topical potent steroids and use only the low potency class. Daisonide stimulates synthesis of the enzymes that decrease inflammation. It suppresses the mitotic activity and causes vasoconstriction. So these topical steroids should be preferred for Pityriasis alba. And here one can see hydrobase and daisonide cream, hydrocortisone cream, and fluocinolone acetonide cream which can be used. These are the moisturizer which can be used, hydrobase. Now continuing the treatment, non-steroid creams such as pimecrolimus 1% cream, tacrolimus ointment 0.1% can speed up the resolution. Sunscreen for effective sun protection like SPF 30 to 60. Cosmetic camouflage may be required as a makeup. PUA therapy in severe cases is considered, and targeted phototherapy may help reverse or stop Pityriasis alba. So here one can see the pimecrolimus cream and the tacrolimus cream and LED ultraviolet A targeted phototherapy, PUA therapy, and the other things which can be used for this purpose. Now, tar paste may be helpful for chronic lesion on the trunk. Laser therapy 3 to 8 nanometer excimer laser twice a week for 12 weeks is effective. New sorbital furfural palmitate ARGG27 cream, and then RV2427B cream, effective in 80% of the patient. It contains 4% zinc oxide, 2.5% tricolloidal oat extract, 0.5% oat oil, 0.2% copper sulfate, and 0.1% zinc sulfate. Here one can see the tar paste and the Alzheimer laser which is being used on the affected skin. And here one can see the result of all these treatment before and after treatment. And here again the before and after treatment result by the different modalities that has been applied in different cases. So that was the end of the lecture, and I hope so you have liked that lecture. If you have liked that lecture, please subscribe and share it and tell it to the others. It's a very common topic, and most of the time the people are not knowing. They are just saying that white spots are due to the calcium deficiency or the iron deficiency. You get check all these iron and calcium, these will be normal, but it is a just fungus, it's just inflammation or a kind of mild eczema which can be corrected by using. Still have any question, you can call me or you can just write to me about any question. And thank you very much for with me and having my lecture. Thank you.